Hello everyone, and welcome to our presentation for our Global Perspectives of Health class. My name is Karis Wilder. In this group, we also have Danielle Pfister, Marissa Bernards, and Shakira Mosby. Our topic today will be malaria. Our main objectives throughout this presentation will be to define malaria, discuss how malaria is contracted, outline the nursing and midwifery indications that are important to malaria, discuss health promotion and how it relates to malaria, discuss malaria prevention, and lastly, we are going to discuss various treatment options that are available. First, we are going to define malaria. Malaria is a very serious illness that is derived from a parasite that lives in mosquitoes. A human is often infected when they are bitten by an infected mosquito. After they are infected, individuals begin to experience fevers, chills, fatigues, and a number of other flu-like symptoms. If not treated, this disease can cause seizures, kidney failure, can put someone into a coma, can cause neurological changes, and it can even, in the most serious cases, cause death. In 2008, malaria caused over 400,000 deaths. The most vulnerable populations are children, pregnant women, and those who have a compromised immunity. Malaria occurs primarily in poor tropical and subtropical areas around the world. In a number of these places, there are scarce resources, and the socioeconomic stability is very poor. This leads to larger barriers in controlling the spread of malaria. Epidemiologic, ecological, and religious implications related to malaria. As previously discussed, a person is infected with malaria after they have been bitten by an infected mosquito. Once bitten, the parasite infects the person's red blood cells, causing damage to occur. It typically takes 9 to 30 days for the symptoms to start spreading. Once a person has successfully recovered from malaria, they then develop immunity for future infections. When looking at the ecological aspect of it, the recommended way to reduce the spread of malaria from mosquitoes to humans is by large amounts of pesticides to kill the mosquito population. This is also called vector control. Lastly, when looking at the religious aspect of it, many people call into consideration or to question their faith after they have a devastating event, such as being bitten by a mosquito infected with malaria, or they have lost a loved one to malaria. The economic impact of malaria is significant for individuals, families, and governments. According to the CDC, the economic impact of this disease is a global direct cost of approximately $12 billion per year, and the lost economic growth, which cannot be measured in monetary value. Because of malaria, countries at higher risk of infection are not often visited by tourists. Related to the high cost of prevention and treatment of this disease, public health resources and government funds are often required to prevent and treat malaria, which is how this disease has a political impact. The CDC states that costs to governments include maintenance, supply and staffing of hospitals, purchasing of drugs and supplies, public health intervention against malaria, such as insecticide spraying or distribution of insecticide-treated bed nets, loss of days of work, which result in a loss of income, and loss of opportunities for joint economic ventures and tourism. Socially, people have to miss work, school, or other life activities due to this illness or to seek treatment. People may also have to plan and attend funerals for loved ones who have passed away from this disease. Oftentimes, when people miss work, they are also missing out on pay for themselves and for their families. Nursing and midwifery implications of malaria. Malaria is a major global health issue, one that nurses must come together to recognize and treat appropriately. Nurses should be encouraged to participate in prevention of this disease. Nurses and nurse midwives must be able to recognize the signs and symptoms of a malarial infection. According to the Center for Disease Control and Prevention, the classical malaria attack lasts for 6 to 10 hours. It consists of several stages. The first stage is a cold stage, which is a sensation of cold and shivering. Next, you have a hot stage, which includes fever, headaches, vomiting, and seizures in young children. And lastly, you have the sweating stage, which is sweats, tiredness, and eventually a return to your normal temperature. More commonly, patients present with a combination of the following symptoms: fever, chills, headache, nausea, vomiting, body aches, generalized malaise, and/or an increased respiratory rate. Diagnosis is evident by a demonstration of parasites in the patient's blood, usually found by microscopy. Additional laboratory findings include mild anemia, mild thrombocytopenia, elevation of bilirubin, and an elevation of amniotransferases. For nurse midwives implication, pregnant women are at increased risk for malarial infection, primarily because of the decrease in their immunity while pregnant. There's information that malaria in early pregnancy can cause problems with the vasculature of the placenta. A randomized controlled trial in 2019 done in sub-Saharan Africa compared the medication dihydroantimazine piperaquine, which is DP, or sulfadoxine permethamine, and found that there were no significant differences in the birth outcomes. However, the group that received DP had less asymptomatic malaria, maternal anemia, and significantly lower levels of parasitemia, both in pregnancy and after delivery. Discussion of health promotion. Health promotion is a very important tool in global health. According to the World Health Organization, health promotion is the process of enabling people to increase control over and improve their health. However, health promotion does not just occur on the individual level. According to Kumar and Preetha, true health promotion is a combination of the individual, community, and health systems. As it relates to malaria, health promotion on the individual level includes access to insecticide-treated nets, or ITNs. These should be used nightly by each individual. At the community level, this includes supporting and implementing programs for malaria prevention, mosquito control, and empowering members to take responsibility for distributing bed nets. At the health systems level, promotion involves the integration of malaria vector control and personal protection equipment. Overall partnerships are the key in the control of malaria. As midwives, we can help by not only providing education on the etiology of malaria, but by also ensuring adequate communication and partnerships on the individual, community, and health systems level. This graphic depicts what was discussed on our previous slide. It is very important that we as a society come together on all levels to help promote malaria prevention. We also need to eliminate barriers that prevent individuals from accessing care. If we do this, we can help prevent the spread of this disease. Malaria is the most prevalent disease in Africa. Even though malaria is the most prevalent, the good news is that it is also preventable, treatable, and curable. Knowing this, we, as future midwives, should provide the tools and resources to help educate our patients and promote better health outcomes. When discussing health promotion, it is important to take into account health inequities like patterns of health consumptions, environments, and cultural beliefs. Health education is a very important way to promote health when it comes to malaria. In cultures where malaria is prevalent, the lack of education on the disease is in part due to behaviors and practices. A study by Amarin presented two strategies to provide this education, one being the behavioral change communication, and the other being rollback malaria. The behavioral change communication aims to ensure that individuals, families, and communities are taking preventative measures to prevent malaria and improve the overall recognition of malaria. The rollback malaria strategy focuses on early detection, rapid treatment, multiple prevention, and well-coordinated actions. As nurse midwives, these initiatives are great places for us to start in promoting health in the areas that malaria is rapidly spreading. It is very important that we as future midwives understand how malaria can affect pregnant women and their newborns. Complications can include anemia, spontaneous abortion, stillbirth, low birth weight, and preterm delivery. All of these contribute to the maternal and child mortality and morbidity rates. According to the World Health Organization, sleeping under an insecticide-treated net and receiving 2 doses of prophylactic treatment during pregnancy decreases the risk of infection and complication. In 2011, a study in Uganda showed that only 48% of pregnant women took the first dose of antibiotic, and only 27% took the second dose, even though both doses were free. As midwives, we need to do our part in understanding the obstacles of these women. It's very important that we look at obstacles on the social, economic, and political level. As a first point of contact for many pregnant women, it is very important for us to assess barriers in accessing preventative services, especially in order to optimize health promotion. A study by Bellamy et al. Compared the preventative actions in two groups of women based on their knowledge of the etiology of malaria. After the education was completed, preventative measures increased because now the women had a better understanding of what the disease was and what they could do in order to help prevent the spread of the disease. Overall, this study helps to show that proper health education is the pinnacle of health promotion for malaria, and additionally for every other disease that we face in the world. Disease prevention strategies. Awareness and assessment of malaria risk include physical location, such as do you live by a body of water, time of year, because warmer months have higher transmission rates, and the time of day, because bites are more likely to happen from dusk until dawn. Avoidance of mosquito bites includes strategies like using DEET insect repellents, protection over doors and windows, and using ceiling fans. There are two types of chemoprophylaxis: causal, which provides absolute prevention, and suppressive, which suppresses the parasites and related symptoms. Early detection and effective treatment have been shown to lower the rates of adverse effects. Between 2000 and 2015, there has been a 37% reduction in the incidence of malaria worldwide. This reduction has been attributed to economic development and urbanization in the developing countries, as well as an increase in preventative activities and improved diagnosing techniques and treatments of malaria. The main prevention method for malaria is preventing contact between humans and mosquitoes. There are many strategies to accomplish this. As mentioned on the previous slide, insect repellent using DEET, protection over the doors and windows, and ceiling fans are all very effective. The list below shows prevention from the least effective method to the most effective method. What is found to be the most effective method is insecticide-treated nets, because they are impregnated with insecticide and are the only method that provides significant protection and can reduce the risk of malaria by 39 to 62%. It can also reduce child mortality by 14 to 29%. ITNs are shown to reduce placental malaria, anemia, stillbirth, and spontaneous abortion. They can also protect against outdoor mosquitoes and the vectors in neighboring area. So not only do you have protection for your house, but you also have protection for the surrounding areas as well. There are many different types of antimalarials. Chloroquine is the most common, however, it's falling out of favor because of the developing drug resistance. As mentioned before, causal prophylaxis prevents the infection. However, these are not safe for pregnant women or breastfeeding women. You also cannot use them in children under 11 kilograms. Suppressive prophylaxis, like mefloquine, suppresses the infection and its symptoms. This is safe for pregnant women and children over 5 kilograms. However, drug resistance has been reported. Resistance to antimalarials is becoming a very big issue. Recent trials of combination therapy to treat malaria have shown promising results, and some have even been approved by the World Health Organization. Diagnosing malaria in pregnancy can be very difficult. While pregnant women are at a higher chance of having the disease, they are often asymptomatic. Lab results are often inconclusive because in some cases, the parasites from malaria will congregate in the placenta, which make it much more difficult to detect it in the mother's blood. Once malaria is detected, treatment can be very difficult because, as previously discussed, the drugs that are safe during pregnancy often have a very high resistance. The current recommendation by the World Health Organization is quinine and clindamycin in the first trimester and combination therapy in the second and third trimester. Multigravid women naturally acquire some resistance to malaria over successive pregnancies. And lastly, we're going to talk about the integration of Leffer and Mitchell's conceptual model for sustainability in global health. Nurses assisting malaria prevention and treatment efforts from other countries and cultures should use the process for partnership as discussed in Leffert and Mitchell's conceptual model for partnership and sustainability in global health. This includes cultural bridging, collaboration, mutual goal setting, and partnership. In doing so, nurses will make a lasting impact in countries which suffer from major impacts of this disease. Next, we have outlined a list of our references for you to review. And lastly, we would like to thank you so much for taking time to review this presentation. If you have any questions or concerns, please feel free to contact any group member as we will be happy to help you.